Hi, everybody. Welcome back again, Dr. Chuck Wile. And Dr. Wile will share some of his experience with us again. All right, go ahead.
Good morning. I'd like to discuss today the issue of chronic stress and adrenal fatigue. There's a basic principle in medicine, and that is if a cause can be identified, then treat the cause. It seems very self-evident, but it becomes very challenging to identify oftentimes what is the cause of fatigue. Fatigue is probably one of the most common complaints our patients will present to us. And about 30 to 50% of the time, we have no obvious physical cause that can be determined. Humans are remarkably resilient and adaptable, and evolution takes time. Our physiologic stress response has evolved to enhance our overall survival individually and as a species. Any kind of external threat, for example, a tiger for our ancestors, would trigger a fear response in the limbic system amygdala. And this then triggers the hypothalamic, pituitary, adrenal axis, which when the signal gets to the adrenal gland, there's an immediate release of the catecholamines we know of as epinephrine and norepinephrine, which results in a flight, fight, or freeze response. This is the acute stress response. Additionally, the adrenal glands will produce mineralocorticoids such as aldosterone, which regulates blood pressure and electrolyte balance, the glucocorticoids, namely cortisol, which suppress inflammation and regulate our metabolism, and the androgens such as DHEA, dihydroepiandrosterone, and testosterone, which enhance our strength and our stamina and endurance. When the stress is gone, the body then returns us to a balanced state, which is known as homeostasis. However, our modern world, unlike just an acute exposure to a tiger, and our lifestyle create a multitude of stressors which create psychospiritual anxieties, persistent and real delusional fears, which then creates what is known as the chronic stress response. This chronic stress response is what is causing great disease and discomfort for us in our daily lives. Cortisol, the main hormone produced by the adrenal gland, is otherwise known as the life hormone because it is absolutely essential for our survival. When there's inflammation, there's a Goldilocks phenomenon. Remember the children's tale of the bears with Goldilocks? One samples and the soup is too hot, and the other samples and the soup is too cold, but baby bear samples the soup and it's just right. And this is what we're looking for, that just right experience where there is an appropriate balance of our hormones and our response. If there's too little cortisol, then we become vulnerable to infections and to cancers. If there's too much cortisol, then there's weight gain, a moon shape of our face, easy bruising, we feel weak, tired, sad. We need our immune system, our inflammation system, in order to be working just right in that Goldilocks range for us to be able to survive the stressors in our environment. Cortisol is the hormone that is predominantly controlling our inflammation. Now, our colleagues, particularly our endocrinologists, look at the production of cortisol in very absolute fashion, either too much, which produces a disease called Cushing's syndrome, or too little, such as what our former president, John Fitzgerald Kennedy, had of Addison's disease. And these are like the 5% extremes of a continuum. And what I'd like to propose, which is proposed by those physicians that practice functional medicine and anti-aging medicine, is that because this is a continuum, disease is not just confined to the extremes, that as you move down the continuum from too much to too little, as you get into a range, you can also manifest lots of problems. And this lower range of cortisol, which is called adrenal fatigue, is what I want to talk about today. When there is pain and fear, there are 4 times the nutrients consumed by the adrenal gland in order to produce sufficient cortisol to respond to that stress. The nutrients that are most key in this regard are the B vitamins, vitamin C, and the mineral magnesium. Because cortisol is so important for our survival, other hormones that utilize these same nutrients will be shunted. The nutrients will be shunted towards the adrenal for the ability of the body to produce sufficient cortisol. It's really not so much stealing, because it's a redistribution of the nutrients in the body in order to optimize the production of the life necessary hormone. These shunted nutrients will cause a temporary delay of other endocrine activity. And when the demand for these nutrients exceeds the supply of the nutrients, then the production of cortisol becomes erratic and depleted. This can lead us to a depletion of the hormone cortisol, and that is what is known as adrenal depletion or adrenal fatigue. When we do a morning laboratory blood test, the production of cortisol, which occurs during our sleep cycle, we would anticipate that the highest level of our cortisol would be first thing in the morning when we wake up. And if we do the standard 4-point salivary testing for cortisol, you can notice that there is a high in the morning, and by evening it has dropped off. A quick and dirty way to achieve this is with a morning blood test before 10 a.m. And this also shows that pattern. First thing in the morning, your cortisol level will be at the highest for the day. Now, what is the normal cortisol level at this time? It's somewhere between 10 and 20 micrograms per deciliter. When you wake up in the morning and you have a diagnosis of adrenal fatigue, and you measure either by salivary testing or by the morning blood cortisol test, and the result for the blood cortisol test is less than 10, you are therefore in the realm of adrenal fatigue. If it gets below 6, you're in the realm of severe adrenal fatigue. And so using a combination of what the patient presents as symptoms along with intelligent laboratory testing, we can come to a diagnosis which can be managed very effectively. A level that is too high in cortisol, meaning that the body is still able to produce the cortisol, but it's producing it in response to this ongoing chronic stress, would be when the cortisol level is greater than 20. And there are things that we can offer to also begin to calm that stress response system in the body to bring the cortisol into that normal, balanced, homeostatic range. Please remember, in order to effectively diagnose and treat suspected adrenal fatigue, you need a comprehensive physical exam and laboratory studies and a thorough medical history in order to interpret the information. You need a qualified physician healthcare provider, and you'll find this within functional medicine and anti-aging physicians' practice. Fatigue as a general category, it's like the big heading, has very many causes. Causes that you're well familiar with, such as infections. And you see this commonly in like older women who have a urinary tract infection. They may not have what a younger woman experiences with painful urination, frequent urination. They may only have the symptom of fatigue. The cardiopulmonary system can cause fatigue. For example, a woman who has angina pectoris, unlike a man, which is what most of the information is available, because that's where the studies have been predominantly done. We think of angina as pain and pressure in the chest, radiating down the left arm up into the jaw, associated with breaking out in a sweat, being short of breath. In a woman, this may only manifest as fatigue. Some people with sleep apnea, obstructive sleep apnea, which ends up causing snoring, allows the person to awaken unrefreshed and therefore experience fatigue. Medications cause fatigue. Cancers cause fatigue. That's why it is critical to have a comprehensive history, physical, and laboratory study done by a physician, because there are many, many causes to that basic overall heading of fatigue. About 30 to 50% of the time, we can't find a physical cause. Of the causes, probably the greatest trigger for chronic stress is our psycho-spiritual causes. Let me provide what I hope will be a helpful image in this regard. Imagine a sieve that you put vegetables in and you rinse with water. The water drains out of the sieve because it is this metal container with holes in it. Well, imagine that each of us with our psycho-spiritual energy field has a sieve with certain holes in it. And what will punch these holes are of a variety of things, but predominantly our fear will produce holes. Our pride, our fear, will create delusional thinking And this will create these holes so that the energy that we have available to us doesn't stay within our container. And so we have to continually replenish our energy, or we never feel completely awake and enervated, because we are draining out our psycho-spiritual energy through the holes in our energy field. Now, a penny saved is a penny earned, says Ben Franklin, and the variety of the deadly sins of pride and greed and lust and avarice, these are the things that will punch holes in our system. Now, one of the greatest delusional thoughts is that I and my tribe are special and therefore entitled and privileged. This narcissistic, self-focused thought creates arrogance, which will, in the extreme, be a megalomaniac type of response, which we're seeing right now in our world with Putin as he frames his war as a conflict of good versus evil, and he stands in his own mind as standing for good. Consequently, the world becomes framed as us versus them, and this creates bigotry and prejudice. This arrogance significantly exceeds ignorance and logic, and it facilitates a sense of dissatisfaction, feeling that our resources are limited, especially love and care and kindness, because of this chosen blindness regarding our true abundance in this world. This pride-filled, fear-based arrogance also leads to the fear of missing out, so-called FOMO, and consequently to lust and greed, lying and manipulation, and they become simple tools for obtaining whatever. I want what I want when I want it. This creates the holes in our sieve. And one of the best ways I know to address these holes created by fear in our energy field is by using the sealant of love and forgiveness. And in contrast to what is I presented as a very negative way of experiencing the world, we have the ability to choose to experience the world through our heart rather than predominantly through our mind. We can learn to derive pleasure and satisfaction by being, existing, appreciating, rather than being focused on our exhausting doing. And we can learn to be fully present, being mindful, without delusions, and become aware of ourself within the context of this loving, kind, supportive, abundant environment, and experience each moment with a sense of joy and contentment, and live our lives filled with gratitude and appreciation, which is the highest form of prayer. We each have a choice to be deliberately unconscious, or we can remember to wake up to the meaning and the purpose of our life. When we call back our power, when we seal the holes in our energy field, in our life force, we become empowered and whole. Sealing is healing. And then with our energy field rewoven, we can stop the psycho-spiritual energy leakage, which leads to our great severe, and our energy field, our container, will become whole again. And we can be filled with an immense sense of power, and we can then learn to focus this loving energy, this kindness and compassion towards helping others and doing good works in this life. Now, the reason I've spent this time on a kind of philosophical foundation is because if we only try to take medicines or supplements or whatever to address the basic fundamental problem, we won't succeed. Because when I make a recommendation for addressing someone that I've diagnosed with adrenal fatigue, one of the key elements is relax and de-stress. Well, there's lots of ways we know how to relax, but unless we also become very clear that our choices that we make, the ideas that we hold, the way we approach the world with our heart or with our arrogance makes a huge difference with our ability to relax and heal. So, how might adrenal fatigue manifest? How might we notice or think that this might even be a problem for us? Well, here's some things to consider. If you have an energy slump in the middle of the afternoon, like 3 to 4 o'clock, this is a red flag. If there's inflammation increased in our bodies, in our joints, I've got a lot of arthritis. If I'm feeling stressed and uncomfortable, or as I have been in a state of adrenal fatigue, my joint inflammation has dramatically increased. Allergies and environmental sensitivities are tuned in to our cortisol levels. And so if we have more allergy symptoms and greater sensitivity to our environmental toxins that can flare up our autoimmune disease, such as psoriasis and other autoimmune diseases, this is a red flag. If there's frequent illnesses, this can indicate there's a decrease in our immune function. If we have digestive problems, if we experience salt or sugar cravings, then the inflammation is a red flag that we may be experiencing adrenal fatigue and need to address this. Definite inflammation-associated diseases such as cancers, coronary artery disease, Alzheimer's dementia, osteoporosis, skin aging. These are diseases of our degeneration of our physiology and often highly associated with chronic stress and fatigue related to our adrenal fatigue. There are several tests that you can obtain or do that can clue in as additional information to what is going on. One can be done at home, where you simply look at yourself in the mirror and look at the pupils of your eyes, and then get a flashlight and shine the light in your eyes. The typical response of a healthy physiology will be the pupil will constrict and remain constricted. If there's adrenal fatigue, that continual light shining in the pupil, which causes initial constriction of the pupil, if it then can't sustain for greater than 20 seconds, it will then begin, the pupil will begin to dilate. That's a clue that you may be having adrenal fatigue and needs to be addressed. The 4-point salivary testing is the gold standard for addressing the cycle that occurs every single day, the circadian rhythm of our adrenal gland. And a tool that I find very useful is to do a serum blood test when I'm getting various other blood tests. taken before 10 o'clock in the morning. And if that blood test is showing a level less than 10 micrograms per deciliter, that's again a clue that we are dealing with adrenal fatigue. So how do we manage it? What do we do? The key, as I mentioned before, is relaxing and de-stressing. This requires us to really pay attention to how we're making the choices for organizing and living our lives. Too often, we let externals drive us to a point where we become depleted. This is a choice that we have and that we can make. We can learn to meditate. We can learn to go into the garden and get our hands in the soil. We can sing and dance. We can celebrate. There's many, many ways to relax and de-stress. The second key element is nutrients. Nutrients, 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 because what has become depleted, even with the so-called steal or shunting of the nutrients from the manufacture of other significant hormones in the body in order to produce the primary life hormone, cortisol, we need to replenish these nutrients in order to be able to manufacture an adequate amount of cortisol. This doesn't happen quickly. If we're dealing with a mild adrenal fatigue, we're talking like 3 to 6 months to replenish these nutrients. If we're dealing with severe adrenal fatigue, remember when that morning cortisol blood level is less than 6 micrograms per deciliter, it's going to take 6 to 12 months to replenish the nutrients that have been depleted in our body. So don't expect a quick turnaround from this very difficult problem. It is treatable, but you have to have patience with yourself and with the process in order to replete it. The key nutrients are high potency B vitamins. Any kind of stress, even acute stress, will chew up the B vitamins 4 times quicker than ordinary. And so we need to be putting a lot of these B vitamins back into our system, including vitamin B12. And depending on your age and physical health, probably the best way to initially use the vitamin B12 is as drops under the tongue on a daily basis. However, if you're in that significant adrenal fatigue state, we may need to use intramuscular vitamin B12 on a weekly basis, and then progressing to every other week, and then to once a month in order to replenish the vitamin B12. And in order to avoid any kind of neurological problems by overemphasis on B12, we also need to be taking folate into, which is another one of the B vitamins, but it's a very important B vitamin for nerve and muscle function. The other key elements are vitamin C. And the best way to get vitamin C into our bodies is with a liposomal form of vitamin C. A liposome is basically a series of fat molecules that, when they're put together, create like a sphere. And in the center of the sphere, it can have any number of nutrients that are used as a transport mech. The liposome becomes the key transport mechanism, because the fat with the villi in the intestines, which contain fat in the cell membrane, they meld together quickly without needing any kind of mechanic to transport across the cell membrane, so you get much more complete and rapid absorption. And Linus Pauling, many years ago, when he proposed vitamin C as a prevention and treatment for the common cold, and he then went on to demonstrate very effectively how important vitamin C is for our cardiovascular health, for our bone health, for our brain health. Remember, what's good for the heart is good for the brain, is good for the bones, is good for the gut, is good for the immune system. Vitamin C is one of these key elements that we need to be consuming multiple times a day because we don't have the capacity in our bodies to produce it ourselves. This vitamin C is best absorbed as a liposomal form. And the next key element is magnesium. Magnesium is a mineral. Now, I grew up as a little child. When I had constipation, my mother would grab milk of magnesia and give me that in order to move my stool along. It wasn't pleasant, but magnesium stimulates the movement of the gut. Magnesium probably has over 300 systems in the body where it is a co-element for function. It is key for anything to do with muscles and nerves in the body. And so magnesium becomes very important. And the best form of magnesium is a chelated form. And this is where it becomes very important to discuss with your healthcare provider what is the best form to take magnesium in to suit you. If you have a problem with constipation, then using more of the mineral form, magnesium oxide, can be very valuable. If, however, you've got a very touchy gut and lots of things can stimulate diarrhea or cramps, then you don't want to use the mineral form of magnesium. You want to use the chelated form, such as magnesium glycinate or magnesium aspartate. If you want to enhance your cognitive function, you want the form of magnesium that crosses the blood-brain barrier the best, and that's your magnesium L-threonate. So it has to be taken within the context of your whole being, what will suit you the best. But magnesium is a key element here. And finally, an adaptogen formula becomes very important for replenishing the cortisol and the adrenal gland hormones. This is very important, and there are many types of adaptogens. Adaptogens basically support the endocrine glands. Common ones that you may be familiar with are ashwagandha or tulsi, holy basil, cordyceps, bacopa, panax, ginseng, rhodiola root, L-theanine from green tea extract, magnolia officinalis, and philodendron bark. This is not the philodendron plant. This is actually a tree bark. These adaptogens, either singly or in combination as a formula, help to support the function of the adrenal gland. And finally, this I want to get back to the first two presentations. Bioidentical hormone replacement therapy is a key for endocrine balance in the whole body. And so you want a balanced bioidentical hormone replacement therapy in this regard for women, which includes estradiol and progesterone. For man, the estradiol is produced along with the testosterone as a derivative of testosterone. And the key important element that comes from the adrenal gland is the DHEA. DHEA itself is very, very important. It is the healing hormone in the body. And I'll come back to that in just 1 minute, because as part of this protocol for treating adrenal fatigue, you want to enhance sleep. Our sleep cycle is key. Remember, cortisol is produced during the deep phase sleep cycle. And so over-the-counter melatonin is an important element for managing adrenal fatigue, for enhancing sleep, for enhancing and boosting our immune system, for enhancing and improving our cognitive function, has many different helpful supports. One of those is to help with balancing and producing adequate amount of the life hormone cortisol. So there are a number of things that are key to use, one of which I mentioned is DHEA. DHEA is a very important supplement when you're dealing with adrenal fatigue. It has other benefits in the body. For example, if a woman is complaining of a problem with a lack of libido, lack of sexual desire, probably the best, other than relaxing, de-stressing, and identifying what is, the fundamental cause. But if it comes down to thinking there's some physiologic response or need of support, the primary thing that I will offer a woman is DHEA. DHEA is over the counter, so I can make that as a suggestion. She can pick it up herself. The dose will be somewhere between 5 and 25 milligrams of DHEA for a woman. For a man, since women are always more sensitive in life than men, it seems, men can go between 25 and 50 milligrams of DHEA in that regard. It is a very important counterpoint to the stress hormone cortisol. DHEA helps to regulate the production of the sex hormones. It restores sexual vitality. It increases mood and a sense of well-being. It improves cognitive function and memory. It decreases the visceral fat known as metabolic or brown fat that occurs as a ring around our abdomen as we get older. It builds up the proteins in our body. This is an anabolic function, a building up, creating function, rather than a catabolic, breaking down function. So DHEA is very important. It also stimulates the immune system, increases energy, and decreases fatigue. It is an antioxidant and has anti-cancer properties. It helps improve sleep, increases bone density, and decreases atherosclerosis, decreases diabetes, helps with autoimmune diseases. That's a whole lot to consider, but that's the nature of hormones. Hormones don't do just one thing. They do multiple things in the body in a way of coordinating and bringing us into a healthy psychophysiologic balance. The primary side effect, if you supplement with DHEA, is acne. And so if you are a person with acne as a significant problem, then you may want to use the metabolite, which is less triggering of acne, known as 17-keto DHEA. The other thing that can occur with DHEA as a side effect is what's called peach fuzz hirsutism, or the stimulation of unwanted hairs, oftentimes on the face, and this is typically most bothersome to women. Once there is, or if there is hair growth, hirsutism, really the only way to remove it is with various types of laser or cosmetic procedures. But if that is a problem, we need to know about that in order to help to regulate the DHEA level I also don't recommend DHEA as a supplement unless you're over 40 years old. So those are some things to consider regarding DHEA. That basically brings me to the end of today's presentation, and I look forward to discussing the next time, since we've been looking at the macro level, the big picture of adrenal fatigue, or as an element of the big tidal fatigue. I want to look down at the micro level next and look at what's known as mitochondrial fatigue, because this is a fundamental physiologic cause for all chronic illnesses. All chronic illness has as an underlying part of the problem mitochondrial dysfunction. And so we can get into that next time. So for today, thank you for your time and attention. I hope this has been useful, and I look forward to speaking to you again.
Great, Chuck. That's a very great information. And here I want to just, bring about the concept that Wile just mentioned, and which I totally agree. And one of the major concepts here is the holistic view. One of the major shortcomings in the current so-called Western medicine is that we are so used to this sort of one disease, one diagnosis, and one treatment kind of course, this is oversimplified modality. However, even for COVID-19, it is, as we know, people with basic diseases like diabetes are more prone to develop severe COVID-19 problems. Why? Because it's a multifactorial disease process, chronic disease in particular. And so we need to have this holistic view. And hormones, including what Dr. Wile just mentioned about DHEA, what are hormones in our body? Hormones are basically the commands, the communication channel. They're sending basically messages from one part to another, tell the whole body what to do. So this is of critical importance in our body. Oftentimes I sort of use an example like sunlight to all lives on the earth. Without sunlight, nothing will grow. We can survive. The same thing here is that without hormones, our cells will not be able to grow. So postmenopausal or post-andropausal for men, is very similar, is that we all lose these very critical growth hormones. Think about it. Sex hormones are practically growth hormones. Okay, they have effect on practically every cell in our body, from heart, brain, to our bones. And that's very important. And also you mentioned about mitochondria. That is a subject that I have been interested in over 10 years. One major reason is, again, because mitochondrial number and function declining is practically present in every chronic disease that I have researched on. I have not found any chronic disease, aging included, that without mitochondrial functioning declining and also the number declining, unless such study has not been carried out. So those are very important. Thank you again, and Dr. Wile, I'll see you next time.
Thank you.